and welcome everyone to the Livewell Kalkaska Substance Free Coalition's Coffee with the Coalition Forum. This is an open and informal discussion about substance use disorders and related topics and concerns within Kalkaska community in Northern Michigan. So could everybody introduce yourselves except for Leslie? I'll introduce you. Dr. McGrahm.
Dave McGrahm from Traverse City. I'm the medical director of the Northern Michigan Opioid Response Consortium, and I'm also a member of our local fan chapter advisory board and the Grand Traverse County Drug Free Coalition.
Bonnie?
Yep, Bonnie Zabel. I am the Northern Michigan Regional Coordinator for Nation Outside. I also work with the NLA, which is the National Lifers of America Association. So those are our men and women with long, indeterminate, and life sentences that are incarcerated in our Michigan prison system. And I also am on the Coalition for Voting Access for All, that you guys are more than welcome to attend those meetings, which are Fridays at 12:30 if you like. Love to have you talk about what you do there. It's a great networking ability for voting rights all across the state. So just happy to be here. Thanks, Suzanne.
Yeah, thank you. I'm Suzanne Prentice. I'm the coordinator of this coalition and prevention specialist for Kalkaska County. And I'd like to introduce Leslie Telfer. Is that how you pronounce your last name? Telfer? Yeah. She's the nursing supervisor with Addiction Treatment Services. Leslie is here to tell us about their new mobile MAT unit, which will be kicking off here this upcoming month in Kalkaska and other counties. So go ahead, take it away, and I will, let's see, let you share the screen if you need to.
Oh, okay. So as Suzanne said, I'm Leslie. I am the nursing supervisor with Addiction Treatment Services, and a big part of my role was to the goal for my role was to get the mobile MAT unit initiative up and rolling. We have a mobile unit that our goal is to provide on-site and access to care for under-resourced individuals. For instance, Kalkaska County, Manistee County, the reservation, Shabbytown, places like that where there's individuals who have barriers to getting the substance use disorder treatment that they need and want. So the mobile MAT unit is going to come to the sites once they're established. An individual could be a referral, either, emergency department or counselors, therapists, groups like, the coalition. Come on, do a brief substance use disorder assessment, just to kind of gauge what that person's needs are, whether it be, withdrawal management. I'll have a peer recovery coach on board with me at all times, just for that added layer of support for these individuals. I'll have ability to run insurance through Recon and come up with a game plan for folks who are uninsured or underinsured, whether it be a sliding fee scale or getting them in touch with our access department to see what kind of grant money might be available for them. I'll also have the ability to run MAPS reports just to ensure that clients aren't on any controls of providers. They would do a urine drug screen right on the bus, meet with our physician's assistant, Julie Moore, via Zoom. Be a laptop right on board so they can access services with our physician assistant, a therapist if that's something that they're in need of, again, the peer recovery support services. All of that they'll be able to do right on the bus, whether it's myself, the peer recovery coach, or one of our staff members via Zoom. In terms of the medication assisted treatment, our we're going to be doing Sublocade and Vivitrol, which are the extended release injectable medications. Those are the medications that are available with, there's no potential for abuse with those. They get the injection once a month, and then bringing the bus out to them, they'll be able to do their follow-through care, their once a month appointment with our PA, or meeting with their therapist once a week, once every other week, whatever that might be. But just the big picture, getting these folks the services that, like I said, they want and need, but might have, no transportation, no funds to make it to appointments up in Traverse City so that they can follow through with their care. We will have Narcan and safe syringe on the unit, but that's not our big goal. Our big goal is treatment, and getting folks the access to these things. So again, those things will be available on the unit if someone comes up and asks for them, but that's not our big picture, I should say. So as of right now, I met with a coordinator from DHD 10. We're discussing piloting the program in 2 or 3 counties to see how it goes. And then Kalkaska, Aaron Popa approved for the unit to be in the municipal lot next to the museum there. So starting June 6th, we'll be out there every Tuesday from 10 to 3. I've got Kalkaska emergency room is in the know. Dr. Ansel over there, and then Christine Bissonette. They're both in the know and helped coordinate. So they're, if people come into the emergency room and are needing services, the ER will now know that, that's something that they can recommend for these clients, for these individuals, potential, people who may become clients. And that's kind of where we're at with it.
So Leslie, you mentioned you're starting in June in Kalkaska. Is that one of the pilot sites?
Yes, Kalkaska will be my first, not a pilot site with the DHD 10. My being out in Kalkaska was coordinated through, Aaron Popa and the Kalkaska emergency room. They were seeing a lot of people come into the emergency room needing services, and unless someone comes in and they're in like a ICU level need of withdrawal management, then the ER is going to just refer them out.
Right.
So this will be a resource now that they can say to people, this is what this is. They're going to be here every Tuesday at this time in this spot, and encourage them to follow up. And because not everybody is in need of withdrawal management or a detox period. Some folks are,
Right.
They ride that fine line. So
What, so my understanding with a lot of folks, there are a lot of people that are buying Suboxone on the street,
mm-hmm.
and they're looking for providers.
Mm-hmm.
So if one of them comes to your mobile unit,
Mm-hmm.
you would switch them to Sublocade.
Suboxone, yeah, Suboxone is an option. in that if our physician's assistant assessed them and felt like that was the medication that was best for that person individually, but that would be something where they would have to come physically into the clinic and see Julie. The
Okay. But it would be an option.
injectable, yeah.
And so, and I'm just thinking about some scenarios. So they once saw Julie once, she said, yes, you're on Sublocade, you should stay on it. Then
Mhm.
would they have to go to see her every time they needed a refill, or could they do that via a telemedicine visit?
Yeah,
Or
so
are
they
you
would,
still sorting that out?
if ideally once every few visits, getting them into a clinic, and we have a resource as far as transportation goes, where
Yeah,
if I'm out in the unit and someone does need detox services, or it's something that they need to get into the clinic for, Julie would like to see them in person. We've got transportation with 217 recovery coordinated, where I can call them and say, hey, we're out in Kalkaska, we need to get this person up to Traverse City. So we've definitely thought about that. And, it's going to be bumpy at first, figuring out all the things. And I think as time goes on, the kinks will work themselves out. And so we do have a resource for that if it's something that the client needs to get here for. But they would be able, ideally, their appointment would be via Zoom on the mobile unit, and then myself administering the injection. Once they see Julie and she's assessed for the appointment and given the go ahead.
thanks.
Yeah, absolutely.
Well, I'll keep asking questions.
I was gonna say, you guys are gonna be over, so you're gonna be next to the trout? Parked
Yeah.
next to the trout, okay. You'll
Yep.
be there during the farmer market. The farmer's market.
Oh, good. And you're there every week, yes?
Yeah,
Perfect.
I'm out of town. Yeah, so it's farmer's market is from 2 to 6.
Okay.
So, but people start setting up around noon, and usually people start coming around 1.
Okay.
So,
Do you feel like that's going to be beneficial, Suzanne, for you to be there doing the things that you're great at doing, and then maybe having that added resource there with you if
yeah, well, let's see how it goes. Hopefully people will go, even though there's a lot of people at the farmer's market and it's pretty close right there. Hopefully people aren't deterred because of the crowd of people. Yeah, hopefully. But if that's the case, I don't know if maybe we'll see how it goes, but maybe Aaron will let you guys park across the municipal parking lot across from the post office, so which would be a little private, but you can see how it goes. I mean, we do have people come in to the farmer's market and grab Narcan from me, or doTERRA bags and lock boxes and stuff, and I usually get quite a few people, but of course I make popcorn, so the smell brings them in, but
yeah, absolutely. Whatever's going to work best. I mean, you've been working that crowd, that area, so those folks. I definitely want to assist in the best way that's the best for everyone.
yeah, well, definitely try it, right there next to farmer's market, and maybe somebody will go over there and see, or see it when they're there, and go and check on it. So
yeah,
and we'll get the word out.
Yeah.
Does anybody else have any questions? You can keep asking, Dave. You have good questions.
I think Bonnie's got her hand going up.
I was just gonna ask, I know in some of the work I've done in Traverse City that they actually have a mobile, like, medical clinic that goes to the Pines and stuff. Have you connected with them? Is that an option? Like, is that one of the Pines in your area? And
So that is Grand Traverse Health Clinic that has the mobile
Right.
medical unit. And they, they're providing more medical care versus
Right.
substance use disorder treatment. So we've got an outreach bus now that goes to 3 or 4 different spots here in Traverse City. And I am talking with Beverly Morrison at the Grand Traverse Health Department. We're talking about me going up there to present to some of the employees there. And it is in the talks for me to be at the Grand Traverse Health Department. So as far as Traverse City, that's kind of the progress we've made with that.
Yeah, I mean, it just totally seems like you guys could cross where, you do one service, they do one service, that at least making the people that need those services aware that there's other options, that there is available, and just kind of coordinating and working like that was what I was thinking.
Yeah, and so DHD 10, they have a mobile unit also that has their big goal with that was Hep C testing, HIV testing, and making referrals for the things, immunizations right on the mobile unit. So I talked to Angie Gullickson at Cadillac Health Department about, how amazing that would be for that mobile unit providing those type of services next to, just kind of coinciding and being able to offer all of those things right on the spot. Because HIV and Hep C is so prevalent in individuals with substance use disorders. So being able to educate and test and refer for those individuals. Definitely been talking to folks about coordinating services where it's appropriate and providing everything that we can.
Have you been able to contact Harm Reduction Michigan and see how you can work together with them?
I have not. And that is, remind me of her name. That's
Pam Lynch.
Pam Lynch. Okay. And she's
Go ahead.
Is she the whole region?
Yes.
Okay. Okay.
How far did you get with coordination with the health department for, like, with Angie on coordinating services? I'm from DHD 10, so.
Oh, hi.
Hi. I hopped on a couple minutes late, sorry.
No, you're fine. So actually I met with Angie, it was roughly 2 weeks ago.
Okay.
Talked with her, presented her with the services that we'd be providing. And then I wrote up kind of like a formal request of the services we'd be providing, which counties we prefer to be in firstly, and then sent that to her. It was actually Friday, so that she can give that to Kevin Hughes.
Yep.
So that's kind of where we're at with it. She said because it would have to have like township approval. Each place that we'd want to be would need the township or city approval. So that's kind of the holdup with securing locations. 5 different people have to approve, so.
What if it's a private place, like a business?
I don't know the answer to that.
I would think.
As far as I know, like when we've taken the mobile unit to events, we just have to have approval from either somebody in charge or the owner, or like when we've taken it to events, we just have to, whoever the coordinator for the event is. When we had it at Trout Fest, we didn't provide any services, but we just had the mobile unit there for people to see. And just know that we have it available. We're really trying to get the mobile unit out a lot more. That's why we have it. So I can't see a problem as soon as location is figured out and we get things figured out, as far as like we have a list of people that can drive it, getting it to and from, and somebody to actually perform the services. But other than that, I can't see there being a problem with it.
Yeah, I was actually talking to Sheila Parker. Well, she's at, Lake Walmasaki County right now, but and she was telling me, one of the barriers that as far as, they were wanting to provide family planning services, and they ran into an issue of getting a controlled a license to do actual medications out of the mobile unit. So I told her I would talk with, Julie, our physician's assistant, and see what the process was for us on that. That way, if there was any, Sheila said it might be because it's different funding, maybe different reasons why. It's frustrating sometimes that it feels like so many barriers to just providing care. That's all we want to do.
Yeah.
Leslie, so a couple of people got on a little bit late, and they're wondering if you can kind of explain it again real briefly.
Okay. So the mobile mat unit, I was saying the big reason, my big role was getting that up and running. We've had this mobile unit, and the goal with it was for it to be a mobile medication assisted treatment unit, going out to point of care, providing services for folks who maybe can't get to Traverse City to see our physician's assistant or our therapist. So my goal is to, for each location, be there once weekly. So for instance, Kalkaska, we've established that starting on June 6th, every Tuesday, I'll be out there. I'll have a coach on board with me for that added support. These folks would come on either walk-in or referral. This is something that was coordinated through Kalkaska. They are in the know, telling folks about it. Brief assessment performed by myself, with health history, and then from there, kind of connect them to the services that they need, whether it be detox, withdrawal management, or if they're past a withdrawal management period, if they're wanting to get a medication assisted treatment, Vivitrol and Sublocade is what we'll be doing on the mobile unit, extended release, injectable maintenance medications. And they would first meet with our physician's assistant, whether it be via Zoom or like I was telling David, we have transportation coordination in place already. So if we're out in a remote area and a person can't get to Traverse City to receive services, we have transportation in place. Have the ability to run insurance through Recon, plan for those who are uninsured or you know, whether it be a sliding fee scale or a grant. And then that there's a bathroom right on the unit. So being able to do urine drug screens to ensure that, you know, if someone's going to get Sublocade or Vivitrol, that there's no opiates in their system. And then the big thing is these people being able to be on the unit doing telehealth with a peer recovery coach, a therapist, our physician's assistant. We also have a psychiatrist on staff. Just bringing, the big picture is bringing these services to folks who have barriers to getting in to Traverse City or to the clinic for the services that they need. So that's the big picture of it. I felt like I just said a lot in a little time.
Thanks for going over it again, because we did have
Oh,
a couple
yeah,
of
yeah.
people jump on late. Does anybody else have any other questions?
I guess just if
Um,
there's anything we can help with, like what, is there anything she needs from us? Is there any connections we can make for you? Like what can we do to help support you?
If, you know, if you're talking to any individuals that you might connect with and you feel and they feel that there's a place that the mobile unit would be useful, and that's something we could make happen. I am flexible and very open to being where I'm needed. And like I said, a peer recovery coach on the mobile unit right with me. Because I don't know addiction firsthand from a firsthand experience. So I feel like having that peer recovery coach on the unit will, you know, provide a sense of security, make folks more comfortable, and also their wealth of knowledge as far as resources. So yeah, if you're, you know, conversing with people out in the community and, you know, you might happen to talk about a place where the mobile unit could be useful, please reach out and I will do what I need on the coordinating end to make it happen, to get out to these locations.
Yeah, Kim in the chat asked, what locations are you looking at?
So Kalkaska was a big one, and Kalkaska and Antrim counties were the two counties we really wanted to be, just because we know the need is there. Manistee County, Benzie County, and then Shabby Town out at the reservation. So those are the primary areas we are focusing on. But again, you know, anywhere where our services are going to be useful for people, we're open. And the, you know, Nimri and Mission, the counties that they cover as far as grants, really like Mount Pleasant up, you know, we are approved to provide care to most of those counties. So if I gotta drive down to Mount Pleasant, I'll drive down to Mount Pleasant. It looks like Kimberly's asking, yep, so on the unit, on the mobile unit would be Sublocade and Vivitrol. If it was any medication aside from that, that'd be something where we'd get them into the clinic to see our provider, ideally 24 to 72 hours after first contact. And I'm not sure if you were on or not for, we've got transportation services coordinated with 217 Recovery, to where, you know, if I'm out in Kalkaska or out in Manistee and we have an individual who needs to get into the clinic physically to see our provider, then I would contact 217 Recovery and coordinate to make that happen for them to get into the clinic. the big thing with the Sublocade and the Vivitrol is, you know, they're extended release injectable medications. There's no potential for abuse. And they're evidence-based to be effective medications for substance use disorder, whether it be opiate or alcohol.
So Leslie, you've been working with Dr. Ansel and other folks in Kalkaska. I'm just curious, and there's no right or wrong location, but you ever consider leveraging the hospital parking lot?
Yeah, that was definitely talked about. Being right there on site. So I think that that's something that'll probably be still thrown around. I think that Aaron felt like the location that he gave was what was going to work best. I think that's how that went. But again, you know, it's going to be bumpy, and we just have to kind of see how it goes. And then for everyone, you know, because like Suzanne said, the farmers market is there and Suzanne's over there. So we definitely want to make services as accessible as we can in the best way that we can. So we'll just have to kind of see how that one goes.
And do you, we talked just a little bit about harm reduction. I think Harm Reduction Michigan partners with Life's Work Clinic in Kalkaska, which I don't know a lot about. And they do MAT, but Susanna, any insights on that? I don't know if the ER refers to that clinic as well, or if they were looking for other options, Leslie. And
Yeah,
they're a
actually,
great option, but again, there's another clinic, but I don't really know a lot about them.
yeah, I invited them on here. I wanted them to come on, and I thought maybe you guys could coordinate, but he must be busy. So that would be Adam. Kim might be able to tell a little bit more about what they have. Oh, okay, so she said the clinic won't
Don't take Medicaid.
Yeah, but I know they do counseling for anybody, not just people with SUD. They prescribe Suboxone. They do have harm reduction supplies there. They have Narcan available, so they do offer quite a bit. So I can get you in contact with them if you want me to.
Okay, and so it's private insurance only that they take?
Yeah,
then?
I think they're working on, last I knew they were working on getting Medicaid. So, but I guess there's a process to that.
Yeah.
So, Kim also asked, will you still prescribe to people with other drugs in their urine, example, meth and Xanax or cannabis?
So that would be all, you know, our providers' choice. I can't, you know, as a registered nurse, make medical decisions. So doing a urine drug screen would be, you know, one of the first things we do once they get on the mobile unit. And then once they get into connection with our physician's assistant, absolutely, I would let her know what substances were in their urine. And then, you know, she would talk with the individual and further assess and make that decision. So that will be something that our provider will decide. Okay. It's case by case basis for sure.
You also asked, what barriers to prescribing do you have?
I think it's more not the prescribing, but you know, and that's not me, that's our provider. But just a lot of lack of follow through with aftercare, getting people to come into the clinic for their appointments, and this is a big reason why, you know, we really wanted to do this, was because, you know, people might want to be you know, they might be ready to go into recovery and would like to explore the option of MAT, but it requires, you know, seeing a therapist and meeting with the physician once a month, and, you know, coming in to get your injection, or, you know, we also require that they be in services with a peer recovery coach and be meeting with them. So I think that ultimately is the biggest barrier, is access to care. Our provider, Julie, you know, she's willing absolutely to help folks any way she can, but we just have to make sure that there's follow through on the care side. So
Yeah. Well, if you can get out into the more rural areas of Kalkaska as well,
yeah.
that would help a lot. Let's see, Kim's got another question. Everyone in the program has to go to counseling? That's a question.
Yes, so as time goes on, the frequency goes down, but yes, they have to be meeting with therapists. And like, you know, this is all things that they'll be able to do right on the mobile unit via Zoom. So we're going to be bringing all of that to them. A peer recovery coach, therapists, their appointments with our provider. Those are all things that they'll be able to do via Zoom. And then if it is a need for them to get into the clinic, again, we, you know, have resources as far as transportation goes. So, yeah, I think that, you know, it should be a requirement for not to just be receiving the working on other parts of your recovery aside from the cravings, you know, the core issues of what led you to you know, your substance use disorder. So
Yeah, she's also asked, what if they don't want to see a therapist? Not everyone is ready for that.
yeah, oh, I don't disagree at all. So again, that would be something that they would discuss with our physician's assistant, what their, you know, their treatment plan is going to be tailored to them. So once they talk to Julie and can talk about you know, what their feelings and thoughts are on what's going to work best for them for long-term recovery, that's, you know, something that could be a decision between the client and Julie. So
Right.
even if it's, you know, not a therapist, you know, we have peer recovery coaches or just, you know, peer support specialists, just some type of follow through that shows that you're active in your recovery.
Okay. All right. Let's see. Anybody else have any questions?
So Leslie, I don't know the whole process, but so say Dr. Ansel starts Suboxone in the ER. I think the Kalkaska ER has access to community health workers, and it might be through DHD-10.
Okay.
I'm not sure which organization provides those, but it's another resource for folks before they see you or even after they see you. And they could, I mean, some community health workers, I don't know all the details about health workers, but some are people in recovery that are recovery coaches that have gone on for further training.
Yeah.
So I'm guessing some of the people that you see may already have a community health worker and or recovery coach assigned, which would be a great resource for you to leverage as well.
Yeah, and it you know, it doesn't have to be ATS, you know, our peer recovery coaches or our, you know, people might already have these services established with other entities. So just, you know, coordination of care, they can talk with with our physician's assistant about it and, you know, get a treatment plan in place that's going to help them be successful. It doesn't necessarily have to be, you know, addiction treatment services providing all of their care. Absolutely not. So.
Right, I'm putting your contact information. Okay. Oops. Anybody else have any other questions?
You're welcome.
I was just gonna ask, just out of my curiosity, you know, obviously I work in the prison system, so they are doing the MAP program that's kind of new in the prison system, and they actually have certain parameters they have to follow. So like what you're saying, they had to actually be drug-free to get on the MAP program. They have to do the therapy, they have to do the follow-up. Is that prison specific as far as the parameters around? And is also that because that's a way for them to track success, or, you know, what are they tracking in those parameters? And do you have anything set up so that you can continue to bring in your data that one will help you continue to get grant money and show your success? And if you have those type of parameters that you have to do, you're doing this coordinating care. So how are you tracking what you're doing to continue to get your grant money and how to get more grant money, if we can find that type of stuff within the data you're collecting?
Yeah, so if it was services that another entity was providing, a release of a consent for release of information so that we can, you know, coordinate with whoever their provider might be to ensure that there is continuity of service and that they're following through. Like I said, there's just so much more obviously to, you know, recovery. It's getting to the core root and working through all of the things. So having these services in place are what's most ideal and what's been, you know, evidence-based, shown to be what works. So, and then if, you know, if relapses happen or there's bumps in folks' recovery journeys, figuring out what led to that, and working with the client. You know, we don't want to see people fail. Absolutely not. We want to work with them to figure out what's going to work best and get them into long-term recovery. So, you know, it's a big reason why we require those things as a part of medication-assisted treatment. All of the variables contribute to it. So, and so, like I said, if it's services that are being provided outside of addiction treatment services, just the consent for releases of information, so we can coordinate with the other providers. And then if it's all within our organization, then, you know, all of our areas of providers kind of work together to make sure that the client is getting the best care that we can provide.
All right, any other questions? We still have 10 minutes. We can get together, maybe we can go to some of these places where I have the naloxone distribution boxes because they're privately owned.
Yeah.
So we have a place over in, let's see, in between Mansalona and Kalkaska, the old Save-A-Lot. We have a naloxone distribution box over there. We've got one at the Bear Lake Christian Church. So
Okay.
between Grayling and Kalkaska, and then we have another one in South Boardman.
Okay.
So, and those are some pretty rural areas, and those, the naloxone that we have in those boxes, they go fast.
Yeah.
So,
Where's the box in South Boardman, Suzanne?
the box in South Boardman is at the country store.
Okay, yeah.
Yeah. So, and he may, I mean, I think he's got some room there. If that doesn't work, there's a tattoo place that maybe they would allow someone to pull in there.
Mm-hmm.
But we'll figure out some more rural areas, because people out in those areas, sometimes they can't get to town.
Yeah.
So,
Yeah, whether it's, no vehicle or they don't have the $10 to put in gas to drive, there's,
yeah, so, but those are some places, I have some pretty good relationships with them, and maybe we can make those some extra stops if,
yeah, absolutely.
Can I ask one more question?
go ahead.
Yeah.
I'm just wondering your peer recovery, like who's providing those? Who are you working with for that? What type of credentials do they need, if any? And do you have all your employees? Are you looking for more when you obviously grow? What will that process look like?
So we have peer recovery coach, and peer support specialists that we employ, like they're on part of our staff. And then Jesse Lewitt, one of our board members, he's a peer recovery coach. So he has volunteered some of his time to be out in the mobile unit with me. And then depending on how things go, having an appointed person, recovery coach with me on the unit, just one person, maybe two, for the mobile unit specifically, is definitely something, in the future that we would talk about. But for now, we'll be utilizing our peer support specialists, peer recovery coaches that we have on staff here at ATS already. And then, like I said, Jesse Lewitt, one of our board members, has volunteered some of his time. So
I think that's great that you guys thought to put that on there. And as you're
yes,
really like putting out what you do, I think if you highlight that will really give people, that's one of the biggest feedback that I get, especially in the returning citizen field, is the trust of going to the medical provider. They got terrible care inside, and a lot of the people that we're servicing obviously have some of that same thing. So I think having that someone that's been in my shoes, someone that understands, is one of the biggest things of providing medical care. So if you can highlight that, I think that would be really, really important.
well, thank you so much for having me today. And if anybody needs anything, has any questions, please feel free to reach out.